Good evening. I just wanted to take a few minutes with you tonight and go through the key points of our reopening plan. As I said in the letter that I sent out to families tonight, we'll have a family meeting on Thursday via Facebook Live, and that will give you an opportunity to ask questions to us and help us to know the parts of our plan that we might still need to clarify for you. But I just wanted to take a minute and share a video with you that you could take 10 minutes and watch with your families and understand what our plan is, and especially the key points on why we're proposing this particular plan. So to begin with, as we've thought about reopening schools, there's some key things that have happened since the end of school that have led us to this point where I really believe we can reopen schools this fall for our students, and I believe we can do that in a reasonably safe and cautious way. So first of all, as you know, here in Idaho, we've successfully entered stage 4 of the Idaho Rebounds Plan. And so within that, there's no provisions that would prevent us from opening school. The second key thing is that the state board, which voted to close schools last spring, that school closure ended when our school calendar ended on May 29th. And so we're no longer under that directive from the State Board of Education to close our schools. And the CDC has issued guidance to school districts saying across the country, here are the guidelines that school districts should be considering before they open schools, and we certainly meet those criteria and those expectations. And then the latest thing that happened last week is, and this week is, Eastern Idaho Public Health, which is our local health agency, has proposed a plan, a regional plan, and within that plan, we would be permitted to open schools. Thus, we see a complete change in the trend line for our currently active cases of the coronavirus here in Bonneville County. And so as long as we stay in phases 1 through 3 of East Idaho Public Health's plan, then we can open up our schools. Although what that looks like in each one of those plans is certainly different, and that's the point of going through this with you this evening. And then fundamentally at the bottom of all that is, as a school district and the public school district in Idaho, we have a constitutional responsibility to provide a uniform and thorough education for our students. And we believe that the very best way we can accomplish that responsibility is through classroom instruction with highly effective teachers. And so we want to do all that we can to bring kids back into school, understanding that our responsibility to educate kids has to be balanced with the need to keep both our staff and our students healthy and safe. And that's really going to be the challenge that we face as we start this school year, is how do we balance those two sometimes competing and contradictory responsibilities. But I feel like we've created a plan that will help us work through and navigate those situations for this school year. So the guiding principles that have really governed our decisions as we've worked to create this plan is, the first one is we will absolutely take reasonable and rational precautions to protect the health and safety of our staff and students. The reality is that we can take just extreme measures, and like happened this spring, the very safest thing we could do would be to close schools and make students stay home and have our staff stay home. If we wanted to make sure that nobody ever gets sick with the coronavirus, that would be the extreme step we would have to take. And we don't feel like that's the right action to take. And so what we have to look at is, knowing we want to and need to open up our schools, what are really the reasonable and rational things we can do that won't create a substantial interference with the educational process, with teaching and learning in our classrooms, and that important relationship with students and teachers, but still make sure that they're healthy and safe. The second key principle is that we will, and we have collaborated with our Eastern Idaho Public Health officials in developing this plan, and they've been very helpful, very collaborative, almost in daily communication over the last week or two with Eastern Idaho Public Health as we've worked to finalize this plan to make sure that we are taking the right steps to make sure that our plan does align with their expectations. As we've had questions that weren't necessarily clear to us, they've been a great resource, and we will continue to work with Eastern Idaho Public Health, those officials that are charged with our community health and safety, to make those decisions as things come up that we may not have anticipated in our plan. And we will use information from those public health agencies. So that includes the Center for Disease Control, that includes Idaho Department of Health and Welfare, and our local Eastern Idaho Public Health as we make decisions. And I know there's tons of information out on the internet about the coronavirus. It's information that I certainly pay attention to and that I read and I try to stay up to date on. But fundamentally, when we have to make a decision for the entire school district, as a public school district, our responsibility is to listen to the public health agencies. And so those are the agencies that we will listen to. We won't necessarily listen to somebody's opinion on YouTube or on Facebook or on a news channel. What we're going to do is listen to those public health agencies who have that responsibility, as I said, to ensure for the health and safety of our community. And then fourth is we fundamentally believe that the very best way for students to learn, and research supports this, is through instruction in the classroom from highly effective teachers. And so we want to do everything we can to make that a reality for our students. Even in situations where we may not be able to do that on a daily basis, we want to try to preserve that classroom instruction as much as we possibly can. But if we get into a situation where that now becomes impossible, then I promise we will make every effort to continue learning through online instruction. That really is our last resort. It's not our first step, it's not our second step, it's not even our third step. But at some point, if the active cases in Bonneville County continue to climb, if we get to a point where our hospitals have been overwhelmed and they can no longer adequately serve the people, then we're going to have to take drastic steps to help mitigate mitigate the spread of the disease and slow it as much as we possibly can. And that is where we would finally have to go back to a soft closure and have students learning at home. But I really believe that as a community, if we come together and we each take our individual responsibility to try to slow the spread, if we listen to the advice and counsel that we've had from our local health officials, and do the things that they're asking us to do in their plan, things that include wearing masks in public, and I know that can be a controversial issue, but if we will take those necessary precautions, I believe that that's the right step for us to take, and gives us our best opportunity to slow the spread of the disease. And that is what will help us as a school district continue to keep kids in the classroom where we want them to be. There are some key guidance and principles that came from the Center for Disease Control, and I'm not going to go into these in detail, but just know that these are in our plan. This guidance from the Center for Disease Control is really what shaped the bulk of our plan. And then as East Idaho Public Health released their information last week, we took what we'd really worked on for the last few months and just made a few adjustments to make sure that we were completely aligned with the expectations from Eastern Idaho Public Health. So within that, just as a broad overview, the Center for Disease Control identified 3 levels of education that could happen, and each one of those presents a different risk. And this really goes back to what I was speaking about a minute ago, and that is that the very lowest risk for us for transmitting the disease is online instruction at home. The highest risk is coming back to school just like normal and not taking any precautions. And so what we've tried to do is target a plan that falls really in that number 2 category. So we have 3 different phases in our plan that would all comprise different levels of moderate risk that again aligns much more closely to what our public health officials at East Idaho Public Health have told us. So with that, there's one other really key thing that goes into why we've created the plan that we've created, and that is what happens when a student becomes ill with COVID-19. So if any student or staff member becomes diagnosed with COVID-19, then there are going to be some necessary steps that we will have to take as a result of what East Idaho Public Health asks us to do. And the first one is that any individual that student has been in close contact with will need to be quarantined. And so typically in a classroom, so let me take a step back and say close contact is defined as being within 6 feet of another individual for 15 minutes or longer. And so in a typical classroom, students will still be sitting within 6 feet of each other. We've gone into our classrooms, we've tried to create as much physical spacing as we can. We'll continue to work with our teachers to create as much physical space as we can. But the reality is, with the number of teachers that we have and the number of teachers that were allotted from the state and the number of students we have, we're going to have class sizes that are still 30 to 36, and there's literally nothing we can do to shrink those class sizes. That's all a function of state funding and the number of teachers that we're told that we can hire based on our student population. So the reality is we will have students that are sitting within 6 feet of each other. So if one student gets sick, then any other student who is sitting within 6 feet of that student would also be quarantined for 14 days. That's going to have a very significant disruption to our education. And that's a key thing that we've thought a lot about the last 2 to 3 weeks on how do we ensure that learning continues for those students who end up being quarantined as a result of a confirmed case in that school's population, or not in that school's population, but in that student's classes. And then if you think about that in the elementary level, we're typically talking about 9 to 20 students. And just that teacher's classroom, it's likely going to be between 7 and 9 students. But if those students are shared among teachers as they go in for reading help and support or for extended learning activities, if those students are shared among multiple other classrooms, then we're now multiplying the number of students that could get sick, and that number could go up from 9 to as many as 30. In 4th through 6th grade, again, we see a lot of our teachers that do share students. We have one teacher that's particularly effective in teaching math, and so he or she might teach math, and another teacher might teach reading and writing. And so when teachers share those kids, now their chances are that we're multiplying the number of students that student's in close contact with, and it could be as many as, like I said, up to 30 students that are quarantined in the elementary level. At the secondary level, students are taking 6 class periods each day. And so now as you're talking about 7 to 9 students in every class period, we're talking up to 54 students that could be quarantined. This would also impact students who ride the school bus. And so as students are on school buses, again, I promise you they'll be in close contact with each other. Most of those students will be riding the bus for more than 15 minutes. And so those students that ride the bus with the student would also be quarantined. So this is just a key fact that we've had to recognize as we've created our plan, and realize that we have to have a way to provide both classroom instruction for the students who are able to remain in school, as well as online instruction for students who could be quarantined for 14 days. And in some cases, it could be longer if there are other students in their class that also become diagnosed with the coronavirus. And so that's what's led us to this 4-phase plan that we're sharing with you this evening. We're starting off, and our intent is to start off in the low risk phase. That's currently where we are as a county. We currently have just under 60 active cases in Bonneville County, or at least that's where it was earlier this afternoon. I haven't checked this evening to see if it's gone up, but chances are it's probably gone up from there. If that case number continues to climb and we reach more than 120 active cases in Bonneville County, then we will have to move into phase 2 before school even starts. And so, again, I don't think I can emphasize enough our community responsibility to do everything we can to try to slow the spread of the disease. And so I think in my own family, we've got to be much more mindful about wearing masks in public where social distancing can't be accomplished. We have to be really thoughtful and deliberate about the situations we're putting ourselves in, how large groups we're associating with, how much we're willing to risk catching the disease ourselves and then potentially being a transmitter of it. So I think for all of us, we have to really think about what the likely outcomes are if the disease continues to climb and those active cases continue to climb in Bonneville County like they've been doing for the last week or two. So with that, again, our intent is to start school in phase 1, which is our county still being identified as low risk. And in this situation, what we're proposing is a change to our calendar. And there's essentially 3 key changes that would happen in the calendar. So the first one is that every Monday for our secondary students, 7th through 12th grade, would be designated as an online learning day. Students would be expected to complete about 4 hours of online learning at home on that day. And teachers would also be available to help support students for about 2 hours every Monday morning. So we would still run school buses. Kids could come in and get help from teachers. If they didn't have a way home, or if they wanted to stay at the school and access the school's computers and devices to continue their learning at school, then we'd have aides and paraprofessionals who could help support them with that. But teachers would essentially, in 7th through 12th grade, would be taking those Mondays, the first 2 hours to help support students who could be struggling or who just need extra help in their class. And then the rest of the day, they would be planning instruction for the week that would include both online instruction for those students who could be home, as well as face-to-face instruction for the students in their classroom. That's just a very significant difference from what we've typically asked our teachers to do, and it's critical that we provide them enough time to be able to do that effectively so that we can continue learning as much as we possibly can. Had great discussions about that plan with our elementary principals, and they felt that we wanted to preserve as much face-to-face instruction as we could while also recognizing elementary teachers are going to need some extra time as well. So the plan for elementary is to take 2 Mondays a month and have students participate in about an hour of online learning at home. So pretty minimal online learning in the elementary school at home on those Mondays, but we still want to keep them engaged in their learning. And then our elementary teachers will be spending the bulk of their day, again, planning now for a 2-week instructional period, again, online instruction as well as face-to-face instruction. So a couple of key questions I'm sure on your mind already is, why did you pick Mondays? Because my husband or my spouse has Fridays off, and it's much easier for us as families to have Fridays off. And I'll just tell you, I certainly understand that. I'm ignorant of that fact, and it's a key point that we talked a lot about as a district leadership team and with our principals on what the right day of the week is. The reason why we propose Mondays is simply the fact that there are a number of Mondays that we have scheduled as days off already in the year. We have Labor Day, we have President's Day, we have Memorial Day. There's a teacher planning day already scheduled in January. So there's a lot of Mondays that are off. And so our concern is that if we used a different day of the week, then on those Mondays that we had off, that now creates an imbalance in the number of days, especially as we move into phase 2 and 3 and students get onto alternating schedules. So that instructionally, we felt that Mondays was the right day for our students and for our teachers instructionally. It gave teachers a chance to be ready for the week. It would give them a chance to review what happened the past week and be ready for the coming week. So that being said, we do have, and we will be asking input from our families and our communities. We'll be asking our teachers as well if they feel like Mondays is the right decision. And so we're asking for that feedback through a survey. I'd encourage you to leave your thoughts and feedback with us, but please understand, I understand the family care issue, and we were really balancing the impact with families, or weighing the impact with families versus what we really felt like was best instructionally for students and what could happen if we had to move into phase 2 or phase 3 and students are supposed to be attending school for 2 days a week, for example, on phase 2, and now Monday's off. Now that group of students is essentially receiving half of the instruction that the other students are. I know we can balance that by then alternating weeks, but we felt that could lead to a lot of confusion for our families. And so just trying to keep things as simple as we possibly could for both families and teachers, and trying to maintain that instructional balance. We felt that Mondays was the right day. But again, feel free to provide feedback to us, and I promise you we'll read through that feedback, we'll evaluate that feedback, we'll share that feedback with the board. Ultimately, the board will need to make the decision because the board is the one who adopts the school calendar for the year. So we'll take the information from the surveys, we'll share that with our school board. We'll still make the recommendation we feel is best as a district leadership team, but ultimately the board will make the decision on what day of the week is the right day to preserve as online for that online instruction and for teacher collaboration time. With that, the other key things to know is that if this change is approved by the board, then we would no longer have early release days on Wednesdays. So Wednesdays would be full days of instruction. And then the extra Fridays that we have scheduled off right now for teacher collaboration days would come back into the schedule. So this would replace both of those, that extra collaboration time that we've already scheduled for teachers in the calendar. So let me just go through the schedule quickly then. So that's the phase 1 schedule. And phase 2, which again, phase 2 we would have to move to if as a county, if we end up in phase 2 or moderate risk from Eastern Idaho Public Health, which again, their current benchmark that they proposed, it has not been finalized yet, but the proposed benchmark is 120 active cases of COVID-19 in Bonneville County. So if that happens, then their recommendation is that we limit groups to no more than 150. So I feel like we felt that the responsible thing for us to do as a school district is to try to get as close to that 150 number as we can. And again, it won't be possible, but we'll try our very best. And so as we think about the place that typically we have the most students come together is in the cafeteria. So for example, in our elementary schools, our large elementary schools have about 600 students in them. On an alternating day schedule, we would now shrink that number down to 300. And that's much more manageable, and we can create much more physical distancing in the cafeteria. We'll be much closer to that number. In our high schools, 1,200 is a pretty average number. Thunder Ridge, of course, is going to be about 1,500 to 1,600 students this year. Bonneville is going to be about 1,000, and Hillcrest is going to be sitting around 1,200 students. So on an alternating day schedule, we'll now be looking at about 600 students at the high schools. On a split lunch, there'd be about 300 students on lunch at a given time, and typically about half of our kids eat. So we feel like we can get much closer to that target number of 150 students. So those are, that's the reason why we feel like we would need to implement an alternating day schedule where only half of our students are in school at a given time if as a county we're at phase 2 or moderate risk for the outbreak of the coronavirus. Then in phase 3, which is high risk, the trigger point for this I think is 230 active cases Bonneville County. And so our step on this one, it's not really popular, but again, under the premise that we want to try to preserve as much online instruction as we possibly can. Students would now basically be divided into 4 groups, and they would only come to school for face-to-face instruction 1 day of the week, and the other 3 days of the week would be at home with their 4 days of the week would be at home doing online learning. So we have a schedule here that kind of breaks down what 25% of our student population would look like. And then the last phase, again, is really what we experienced last spring, phase 4. The trigger for this, again, is not the number of active cases in Bonneville County, but rather it's how much has that impacted our hospitals and what's the hospital utilization rate, including the ICUs. And so if we go to critical risk as a county, then at that point, we would have to shut down our schools. We'd have to go back to telework and all those things we experienced last spring. So again, I just can't encourage or emphasize enough that I really feel like we all have some collective responsibility as citizens to do all that we can to follow the precautions that have been advised to us from our health agencies and try to do everything we can to slow the spread of the disease so that we don't progress all the way from phase 1 to phase 4 this year. So beneath that, just a couple of key things. We are asking our families to please check your students for symptoms every day before you send them to school, not just when they tell you that they're not feeling well, but every day if you check their temperature, and if they're running a fever, please keep them home. Again, that may not be coronavirus. It's not. If you have a fever, then we know you have it, but it's certainly a key indicator that a student may have it. And so what we want to do is keep that student home, and if we can do that proactively, then that could really minimize the number of students that end up getting quarantined if that student shows up to school and is now diagnosed with it. So the more that we can be proactive and really keep our kids home, the better off we'll be as a school district, and the more we can keep ourselves down in phase 1, phase 2, and phase 3. We want to keep those children home for 72 hours, and I know that that's a lot. Typically in the past, we've asked only for 24 hours for students to stay home. But now, in the current guidance, we're saying 72 hours until after those symptoms have subsided. That's a lot of time away from school, and I know that that's going to be an impact to our families that have both parents working, or to our single-parent families, or lots of other situations. I know that that's going to create a burden, but I just ask you to please follow that guidance for the health and safety of the rest of the class and the rest of the school. With that, again, this is why we're asking for that extra time for our teachers, is rather than just having your students home and waiting, to come back to school to get their work, our intent is to provide online instruction to them to keep them learning. We're asking our teachers to do some streaming out of their regular classroom instruction so that they can still participate and engage with the class. And so we're doing everything we can to try to meet you halfway, I guess, to meet our families halfway and say, if you'll keep your kids home, then we'll do our part to do everything we can to keep them engaged with their learning and keep them going if the students are feeling well enough to participate in that. We're asking our staff to also follow those same requirements, to check their temperature every day before they come to work, to make sure that they're symptom-free, and to also, when kids come to the schools, we are going to ask our teachers to please check their temperatures twice a day, once in the morning and then once around lunchtime, to make sure that kids don't have fevers as well. And if we do end up with kids with fevers at school, then we will ask them to go down to the office and wait for you to come and pick them up. Because again, what we're trying to do is just slow the spread of that disease as much as we possibly can. And the best way to do that is to not leave them in the classroom where, again, they're going to be in that contact zone for 50 minutes with other kids, and just try to keep the risk of the contagion as low as we possibly can. When it comes to activities in the school, again, you can see as you read this plan that we're taking steps to limit the activities, really trying to stick mostly with the things that are essential. We are still intending to continue with our activities that are governed by the Idaho High School Activities Association. So that includes all extracurricular sports and things like the dance teams and music and debate and drama and speech. All those things are under the umbrella of the Idaho High School Activities Association. And so our intent is to continue those unless we get guidance from IHSA or, again, our local health district that says we can no longer continue those. And again, we'll do our very best when it comes to transportation and child nutrition. But when I put my own kids on a school bus, I realize that they're going to be sitting next to other students, and we cannot create that 6 feet of physical distancing. And so We'll have talks in our family about riding the school bus versus kids walking or riding their bikes to school versus getting driven to school. And I know for a lot of families, you live too far away and those aren't all options. But we'll do the very best we can, but there's just literally no way that we can create that physical distancing on school buses with the number of buses and drivers that we have. So those are all the challenges that we're facing, challenges that we've addressed in the plan. And I hope you'll take time to read through the plan. It's a fairly lengthy document. It's about 35 pages. Some of it's quite repetitive because we're doing a lot of the same things in phase 2 that we're doing in phase 1. So you can, I think, fairly quickly read through those sections. But I think it'd be very helpful if you would take time to read that plan and, again, take the time to share your feedback with us through the link that I shared in the text message and email tonight. So thank you so much for your time. If you do have other questions, and we will be doing a Facebook Live meeting Thursday evening at 8 p.m. and you can join us on that at facebook.com/BJSD93. Thank you so much, and just really excited to have your kids back with us this fall. And I know that we're working very hard to do all we can to make that a safe and excellent learning experience for your kids this year. Thank you.